continuing to follow a June healthcare report that painted a grim picture for the future of the Commonwealth's rural hospitals. Last week, we told you about the report from the Virginia Joint Commission on Healthcare that identified more than a dozen rural hospitals as being at risk of closing. Our own Sam Graham has been following this story. And Sam, I understand many of the hospitals named in that report have responded over the past week. What are they saying?
Well, to put it simply, Ron, they're disagreeing with their inclusion in this report. At least 4 of the 5 hospitals in our viewing area that were named have issued statements to us affirming that they remain fully operational and have no plans to close. Let's start with Lewis Gale Hospital, Pulaski, where a spokesperson writing, quote, "We want to reassure our patients, colleagues, and community that Lewis Gale Hospital, Pulaski is not closing. We're operationally sound, remain open, and focused on caring for the patients and families who depend on us." Similar sentiments echoed in the next several days from Duke Life Point Twin County Regional Hospital in Galax and Bath Community Hospital in Hot Springs. The other 2 hospitals named in the report from our viewing area were Carilion Giles Community Hospital in Parisburg and Centera Halifax Regional Hospital in South Boston, both of which were among 5 hospitals statewide labeled as being at immediate risk of closure. We haven't received a statement from Centera, but Carillion's Executive Vice President and Chief Financial Officer wrote, quote, "We have no plans to close hospitals. We remain committed to providing high-quality care in the communities we serve and are continually looking for ways to strengthen services and improve efficiency." Worth noting there that Carillion's Tazewell Hospital was also named in the report that included 13 hospitals in total, marking more than a third of the Commonwealth's 36 rural health facilities.
This is absolutely a crisis. If you close some of these hospitals, people are looking at multi-hour drives to get to a provider.
Well, it's part of the 18-member bipartisan commission that published the 68-page report and says an additional 18 hospitals just missed the cut of inclusion, which would have totaled close to 70% of the Commonwealth's rural hospitals. Board Chair Senator Barbara Favola says many health facilities have already been living, quote, "on the edge" due to rural hospitals typically treating a higher percentage of patients on Medicaid. The report found that changes to Medicaid eligibility under House Resolution 1, that's the so-called Big Beautiful Bill, will reduce the amount of federal funding these hospitals receive.
The expectation by the Virginia Health and Hospital Association is our hospitals across Virginia will lose about $2 billion a year.
Now, it's important to note, Ron, that this is a preliminary report. The committee says it's going to dive much deeper into this data to really get a sense of the full extent statewide over the next 12 months.
All right, Sam, now the big headline in this report is the worry over rural hospitals closing, but even for hospitals that remain open, would this loss in funding impact the services they're able to provide?
Yeah, Ron, the report says many rural hospitals have already reduced or just flat out cut some of their inpatient services just to keep the doors open. So that could mean the loss of things like maternal and child health units, which of course provide delivery and postpartum care.
Wow, okay, thank you, Sam.